There are more healthcare woes in Manitoba. The largest hospital in the province scrambled over the weekend to find enough nurses to work in emergency. The government says it's training more people. Critics say that's not happening fast enough. CBC's Bartley Kives has the story.
This hospital in Steinbach is getting a $32 million renovation. Meanwhile, in Winnipeg, this hospital struggled over the weekend to find enough staff to work in its emergency department. There were only 8 nurses on shift at Health Sciences Centre Emergency on Friday night instead of 24, leaving HSC unable to staff all the beds in its ER.
If there isn't a nurse to look after a patient in the bed, it's just a piece of furniture.
Doug Elfson is a former Liberal MP who works as an ER doctor.
I've been practicing for over 20 years. I've never seen it. To the best of my knowledge, this is the first time this has happened in Winnipeg, to have closures of this magnitude and to have that many beds closed due to lack of staff.
The Manitoba Nurses Union echoes that sentiment.
This is probably the worst we've seen in the last couple of years.
The health minister acknowledges hospitals are struggling.
The pandemic has amplified and exposed some gaps, some barriers and challenges that we need to overcome.
Audrey Gordon thanked nurses for stepping up to fill shifts this weekend, but she chafed at the idea those nurses were difficult to find.
I wouldn't use the term scrambling because the system has been looking at ways to address the needs in the emergency department.
That involves training more nurses. Their union says that isn't enough.
That is a long-term solution that will benefit in 3 to 4 years. So in the meantime, we need every nurse that's in the system to stay in the system.
Gordon says she hopes there won't be shortages this fall. Aolfson says he's worried about the return of cold, flu, and COVID season.
I'm not optimistic that there's going to be a significant change between now and then. I'm apprehensive about the working conditions I'll find.
ERs are also struggling to care for patients waiting to be admitted to hospital. Gordon blames part of that problem on people showing up at emergency instead of urgent care. Bartley Kives, CBC News, Winnipeg.